Hello everyone, in this video I'll be talking about dengue. So what is dengue? Dengue is a viral disease that is caused by any of the four closely related dengue viruses and is transmitted to the human being by an infected Aedes mosquito, also known as the tiger mosquito. It is more prevalent in the tropical areas of the world and the greatest risk occurring in the Indian subcontinent and Southeast Asia. So how does dengue spread? The dengue spreads through an Aedes mosquito when it bites a person infected with dengue virus, following which the virus spreads to the mosquito's body over the next 8 to 12 days. Following this period, the mosquito can transmit its virus through its saliva each time it bites a person throughout its entire lifespan. But dengue does not spread from one person to another person directly. So what are all the symptoms of dengue? But 1 in 4 people with dengue infection actually develop symptoms. And symptoms usually develop 4 to 6 days after infection, and it can last up to 10 days. And symptoms are usually mild to severe. Children and young people who develop dengue infection for the first time usually have milder symptoms. The symptoms are non-specific, and the symptoms include sudden onset of high-grade fever. It can be up to 104 to 105. Other symptoms include pain behind the eyes, joint and muscle pain, vomiting, tiredness, rash, etc. And about 1 in 20 people with dengue infection actually develop severe infection and will require immediate medical attention. So what are all the warning signs of dengue? The warning signs of dengue usually appear 24 to 48 hours after the fever eases. And the symptoms to be noted are persistent vomiting, severe tummy pain, bleeding manifestation like bleeding gums, blood in stools, blood in vomitus, feeling excessively tired, restless or irritable, breathing difficulty, cool and clammy skin, reduced frequency of urination like 1 to 2 times per day, and giddiness, etc. If your child has any of the following symptoms, he or she will require immediate medical attention. So how is dengue diagnosed? Your doctor will take a detailed history, examine the patient, and order few blood tests to diagnose dengue. The blood tests ordered are complete blood count, liver and kidney functions are monitored. And also platelets are closely monitored by a doctor, as low platelet counts can cause bleeding. So how is dengue treated? There is no specific treatment for dengue infection. Assessing your child's condition, your child might be sent home or will require hospitalization, and in severe cases will require ICU care. There is no evidence for antibiotic usage or usage of papaya leaf extract or other medication. To bring down the fever, usually paracetamol is the only drug that is advised. And avoid using anti-inflammatory agents like ibuprofen, mefenamic acid, and also aspirin, as these will all try to bring down the fever but can cause bleeding manifestations. And also encourage plenty of oral fluids, as your child might be dehydrated. If your child is hospitalized, the mainstay of treatment is IV fluid, and platelets will be closely monitored during this time. Rarely, your child might require transfusion. And during the critical phase, that is 24 to 48 hours after the fever eases, that is when your child needs close monitoring. During this phase, your doctor will monitor your child's blood pressure, pulse, urine output, and intervene as necessary. The next video, let's discuss about how to prevent dengue. Thank you for your time.